Hi, this is Long. Welcome to our video series on search patterns for the most common studies in radiology. Please note that this is an introduction to study interpretation. An enormous amount of detail is omitted for brevity. Continue dedicated reading, seeing as many cases as possible, and keep getting feedback from subspecialists during the course of your training. Okay, so today we're going to talk about a basic approach to the ultrasound of lower extremities for DVT. As with all studies, you want to get a sense of what's going on with the patient. What is the clinical context? What's the level of suspicion? And then we're going to look at prior studies, including any sort of CT, MRI, prior ultrasounds of the same anatomy. And then QAing the studies, we're going to make sure that we can see all the vessels of interest. See to what extent we can see things on grayscale, on color Doppler, and then going through the anatomy, each part of the venous vasculature. We're going to look at the waveforms. We're going to look at the morphology of the vessels. We're going to look at the lumen. We're going to, most importantly, assess for venous compressibility. And we're going to look at whether there's flow on color Doppler. We're going to look at the spectral waveforms before and after any sort of abnormality we're seeing. And then we're going to be sure to take a look at the soft tissues that surround the vasculature to see if there's any sort of incidental or other explanatory pathology. Okay, so what we have here is an ultrasound of the right lower extremity, like a duplex study for DVT. And at our institution, we do a color Doppler or a spectral Doppler evaluation of both external iliac veins on every single patient, whether it is a unilateral or bilateral study, and we'll do certain parts of the venous anatomy. So each institution may have a different protocol for how they approach this, so you should become familiar with your own institution's practice. One of the kind of important things to consider, in addition to the presentation, comorbidities, things like that, is whether the patient has focal, like unilateral or bilateral symptoms, or they have central cardiac or systemic cardiovascular issues, whether they have any sort of known focal symptoms that may actually be attributable to the arterial or soft tissue areas rather than the venous anatomy, and that can kind of clue you into things that you may see incidentally. Okay, and you want to take a look, if you're just QAing the study first, you want to take a look to see that all of the venous vasculature as part of your protocol is included. To what extent attenuation of the ultrasound beam is, limits evaluation, especially in patients who are edematous or are larger. You want to see that you can kind of just generally speaking see the anatomy as it's being imaged throughout the course of the lower extremity. Okay, and so kind of starting where we are provided images at our institution, the first set of images is a spectral Doppler evaluation of the bilateral external iliac veins. And so one of the major questions to ask yourself here are, is there normal respiratory variability in that waveform bilaterally? Okay, is the variability potentially flattened? Is there increased pulsatility or phasicity? You want to correlate with that with any history, whether known or suspicion of heart failure or tricuspid regurgitation. You want to see to what extent any sort of abnormal flow or waveform is propagated down the lower extremity. Okay, see, as we look at waveforms even further down. Okay, and then so here we've seen just the bilateral external iliac veins, and then we're going to go down the right lower extremity because that's the point of interest. And so on a grayscale image, you want to take a look at the various vasculature. It can be hard to distinguish the arterial and venous vasculature. Typically, the ones that compress, here you see, so here we have a without compression and then with compression. So the vessels that compress, those are going to be the veins. And we want to take a look within the lumen to the extent possible. We want to look at morphology, expansion, whether vessels are expanded, whether they're shrunken, whether there's calcification, whether there's any intraluminal echoes, and we want to see if they fully compress. Compression is going to be the most sensitive finding for whether or not there is a DVT. If the vessel compresses completely, that is good evidence that there is no thrombus. So we're going to do that at each level down the leg on the grayscale images. One of the let's see. This is a very clear picture here showing that the popliteal vein, one of these vessels, compresses completely. Okay, and we're going to look at the grayscale images all the way down the leg. in that fashion. And then in between, in our particular imaging protocol, the color Doppler images are interspersed with the grayscale images, and we can kind of look at those, at each level as well. And what what the color Doppler images will show you is whether there's flow at all through that vessel. So in some circumstances, you may not visualize a vessel well. In this particular study, we see each of the, all of them pretty well on grayscale images. But in the case that we don't see them well, the color Doppler gives you a sense as to whether there's flow. And so if you do see flow through a vessel, here we have the femoral vein, you do see flow through that vessel. That tells you that there's not complete occlusion in that vessel. So if there is thrombus, it's not completely occlusive. So you can, if you do see color Doppler flow, but you don't see the same vessel on grayscale, you can see that there's no occlusive thrombus, but you can't entirely exclude non-occlusive thrombus. Okay. In the calf veins, and there's different institutions will image different calf anatomy a little differently and include differing parts of the calf vein or muscular venous anatomy. Oftentimes it will be difficult to visualize these. This particular patient we kind of do see well. You see here various vascular channels, and then all but one, the artery compresses well. On here with a without compression and then with compression. But sometimes you'll have to rely on color Doppler here. And then if you're only ever seeing vessels being patent and then kind of compressing well, only on color Doppler, you have to include that caveat. You have to remember that you cannot exclude non-occlusive thrombus. An important thing, in basically for every study that you want to do, but in particular when the clinical scenario is not necessarily very typical of DVT, you want to make sure that you're looking at all of the incidentally imaged soft tissue, muscular, even arterial anatomy, subcutaneous tissue that's imaged here. If we're seeing something incidental in the subcutaneous or other tissues, you want to guide your technologist or your sonographer, or if you're yourself scanning, and do a more dedicated exam in that area. In many patients, we'll see incidental Baker cyst, the popliteal fossa, and to make sure we're throwing color Doppler or any sort of finding as well. But that is going to be really important. Things you may see are, include, incidental, lymph nodes, adenopathy, edema in the lower extremity. You can see vascular abnormalities, collections, things like this. Every once in a while, you'll see as more explanatory for the patient's presentation than an actual venous abnormality. And so to recap, as a basic approach to the lower extremity study for DVT, you're going to get a sense of what's going on with the patient, understanding, where their symptoms are, whether they're unilateral, bilateral, what's the level of suspicion for venous pathology. We're going to look through the study and make sure, to see to what extent we can actually see the anatomy of interest. And then on each of the grayscale images, we're going to be looking at the vessel itself. We're very, very interested in compressibility because that's going to be the most specific, finding to help us figure out if there really is DVT or not. And then as needed, we're going to look for, flow on color Doppler. And then, to get a sense as to more central pathology and, and that impact on the venous vasculature, we're going to look at the spectral Doppler findings throughout the lower extremity. And then just to make sure also that we're looking at the other soft tissues as needed and as a good practice for every study.